note for Stephen McDonald. PSA was 0.18 in June of 2017 period. Negative prostate symptoms. No new pain. Check fatigue. Check poor appetite. Check swelling. ECOG 1. Pain level 2. Pain treatment 1. Prostate exam. Asymmetric prostate with the right lobe greater than the left. Jump lungs. Decreased breath sounds on the right side. Replace dermatologic. 2+ pitting edema in the lower right extremities. Delete neurologic. Jump studies. Show images. Snip image. Scan report. Show chart. Snip text. Jump. Negative metastasis. Jump. The patient will return in 6 months after obtaining a PSA from the referring. Records request. Please obtain bone density report from Dr. Megan Cordes. PET scan. Reevaluation before next visit. Approve this. Show assessments. Show orders. Show charges. Show checklist. Show daily master.
My favorite thing about Palabra is the time that it saves me. Before, when I was having to dictate, I dictate and then days later the transcriptionist would have it done and then I'd have to review it again. But now I can see it as I'm dictating, I can make the changes as necessary, and then once I hit send, it's immediately faxed off to my referring doctors. And I have a surgeon text you or call you and say, hey, thanks for getting me the note so quickly. That's been great. I also love the fact that my completion documents, Palabra just pulls in the treatment dates, the dose, the energy, the treatment technique, all of that. I literally can finish my completion documents in 25 to 30 seconds now, and I love that. My on-treatment weekly checks, they look so good because Palabra automatically pulls in the dose where the patient's at, pulls in the vital signs, so it just makes the on-treatment checks so much easier as well. I mean, there's so many things that I think you asked for one, and I can't stop at one. I find that it helps the clinic run smoothly. I know that my clinical staff, so my nurse notices that my dictations are in there right away. They have a good idea of what the plan is. I would ask someone who's not using Palabra why they're not making things easy for them, because Palabra really makes what we all have to do. We all have to dictate, we all have to document. It makes that so much easier. And so really the question is why aren't you using it?